The new Inside Sources.
Florida's Surgeon General says the state will no longer require kids to get vaccines before attending public school.
What he said is that there will be no mandates at all, and it was super interesting to me that he compared them to slavery.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. All of them. All of them. Every last one of them is wrong and drips with disdain and slavery. Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body? Who am I to tell you what your child should put in your body? I don't have that right. Your body is a gift from God. What you put into your body is because of your relationship with your body and your God. I don't have that right. Government does not have that right. They want you to believe they have that right.
It's definitely interesting.
Yeah, I don't get it. I mean, he kept saying the word should, what you should put in your body. When I go see my doctor, it's so he can tell me what I should be doing. I mean, if you're saying must put into your body, and I think that's what he meant to say, who am I to say what you must do? I guess I would agree with him more. But, dude, you're a doctor. Saying what you should be doing, I don't know that what's the problem with that? I guess I don't understand his argument. And then he compares it to slavery.
Well, first of all, you have to know that this is he is a black man. It's Dr. Joseph Ladapo, and he is a Surgeon General, which is an interesting title. Utah doesn't have a Surgeon General, but Florida, that's what they call it. We have a director of the Department of Health, but we don't have a Surgeon General. But in any case, whatever the label is, he just said no mandates. And what's interesting is if you listen to the words that he just said, those are the arguments that people have made for women having the right to choose what happens with their bodies, right? And so now you have this split where you say you can choose in this situation, but you can't choose in this other one. Very interesting.
Yeah, that is interesting. So you corrected me on something during the break, and I had always assumed that in order to attend public school in Utah, you had to have a vaccine. And I guess that's true in part, but not true in part.
Right, because there are mandates, there are vaccines that you need to have to go to school. However, you can get an exemption for those, and it's actually relatively easy to get an exemption. You can get a personal exemption, and the schools have all that documentation. So you either have to submit the exemption or you have to submit your vaccine record. And if there's an outbreak, for example, of measles, right, we know that there have been at least 11 cases in Utah. I think there were 2 more after kids went back to school. If there's an outbreak, then they are going to tell the kids who are not vaccinated to please stay home during that time.
Oh, I see how it works. Because you say it's a mandate, but there's
a mandate with an exemption available. And I don't know what Florida's law, but you could hear that there was cheering when they made that announcement. And parents in Florida were divided by the decision. Some of them said it was really dangerous. Some of them said they thought it was great to grant freedom to parents and children. One Florida mother had this to say.
It should be the parent's choice whether they're vaccinated. It should be the child's choice whether they're vaccinated.
And another parent had a different point of view.
I feel safe knowing that they're vaccinated, that the kids that go to school with them are vaccinated, and knowing that now that's going to change is a little scary.
I guess knowing that you're sending your kid to a school where all of the kids or most of the kids are vaccinated, to that woman gives her some solace, gives her some comfort. And if you don't know that anymore, who knows what you're going to open up. And I've never understood until the COVID thing came around the idea of herd immunity.
Herd immunity,
but,
yeah.
But I get the impression that if the huge majority of people are vaccinated, it tends to really make a huge difference, more than you'd expect, as opposed to maybe half the people or less than that.
So herd immunity has to do with having enough disease process that you have built up this immunity. The idea behind vaccination, right, is that you create this resistance to these diseases. And so we know that with what we saw with the COVID vaccine, And I know that it can be controversial, but the people who got the disease after the vaccine were less sick, less likely to die, less likely to be in intensive care than people who did not get the vaccine. And I think it's fair to talk about some of these diseases that we used to consider normal childhood diseases were not mild for people. Some people they were, but you think about polio. My dad grew up with people who got polio and ended up in an iron lung. It's not that long ago that polio was really destructive. And now we just don't have it in the United States, but we have a vaccine and babies get it and kids get it before they go to school, right? So you can say there's really a large number of the population that has been vaccinated against polio.
Yeah, I understand the choice aspect of this. I guess what I don't understand, this will open up a floodgate, so it's just as me talking, is the downside to a vaccine. I mean, we haven't seen necessarily, although Robert F. Kennedy Jr. would differ with me, that there's an adverse effect of vaccines. There's adverse effect to anything you do, but
there are ways that people can report adverse effects to vaccines. Now I'll share a personal family story. So one of my daughters, our second daughter that was born to us, was born with significant disabilities, and she also had a seizure disorder. And when she got her first set of baby shots, she did have seizures, and her physician advised us not to give her certain vaccines for the remainder of her life, right? She could get some, but not others. And that was because of her personal risk factors, right? So there are consequences that can happen from vaccines, right? We do know that. But overall, right, that is a decision that people usually make in conjunction with their doctors. And we have a couple of texters who have asked this question or made this statement. One said, having been a parent, parents are not health experts. Doctors should give parents the best information that they and their children need to make a good decision. Somebody saying insurance companies won't cover the vaccines. That's interesting. I think that might be the case with some of the more controversial ones. I don't think it's the case with the childhood ones. We'll see.
But I think what they're saying is if it's not mandated, insurance companies don't necessarily have to cover it.
Right.
And I think that's what some parents are concerned about. Well, hey,
but
if it's just an optional thing, my insurance company won't cover it. And I'm just speaking out loud. I don't know that I'm thinking out loud. I don't know that that's necessarily
right.
true.
But remember, we just had a conversation with Lois Collins, who's she does a lot of health stories for the Deseret News. And one of the things that she said was that the American Academy of Pediatrics is breaking with the CDC on some of their recommendations, specifically on vaccines. So you have a large national medical organization focused on the health of children who are saying, we think you should have these vaccines, right? So I don't know about the insurance company question. We do have a texter asked me the question specifically, what does him being a black man have to do with it? And I think the reason I mentioned that specifically is because he compared it to slavery. So he is someone who is sensitive to that, and he compared it to slavery. I think it would be wildly inappropriate for a white physician to say this is like slavery. I don't know, but that is why I mentioned that. So that's an answer to your question.
Yeah. Speaking of children, Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia, spoke on the progress made by vaccines historically.
In the 1970s, there were school vaccine mandates across the country, but they weren't enforced. And then you had these major outbreaks in Los Angeles, in Detroit, in Alaska, of tens of thousands of people, children who had measles. And with those enforcement of school vaccine mandates, you ended those outbreaks. Now, if you're going to take away that tool, you are going to severely limit your capacity to control these outbreaks.
I think what some people forget sometimes, and this is unfortunate, is the death rate for children before the advance of vaccinations, but also of antibiotics, could be as high as 20%, sometimes even more, right? And people had, sometimes it could be as high as 50%. So you can say, in my family, we make that choice, but it could be that your neighbor's child dies because of the choice that you made.
Yeah, and I think a lot of people feel like choice, especially on the part of parents, is an important thing. So
it is,
yeah,
right?
You can argue.